Current Unaffordable Care Act was created to make insurance companies rich. It was bad health care at much too high a cost. And you see that now in the steep increase in premiums being demanded by the Democrats, and they are demanding those increases, and it's their fault. It is not the Republicans' fault. It's the Democrats' fault. It's the Unaffordable Care Act, and everybody knew it. Again, I want the money to go directly to the people so you can buy your own health care. You'll get much better health care at a much lower price. The only losers will be insurance companies that have gotten rich, and the Democrat Party, which is totally controlled by those same insurance companies. They will not be happy, but that's okay with me because you, the people, are finally going to be getting great.
You just heard him utter the words, and now the tremor hits your nervous system like a defibrillator shock to the national consciousness, because this is the moment where the projection becomes so crystalline, and the gaslighting becomes so brazen, and the sheer audacity of the revisionist history becomes so staggering that you have to grip your chair to maintain equilibrium, while Donald Trump stands at that podium, calling the Affordable Care Act by a name he manufactured out of pure cynical branding genius, the Unaffordable Care Act, and declares with the confidence of a carnival barker selling snake oil that insurance companies got rich off it while simultaneously, and this is the key bombshell here, insisting that Democrats are controlled by those same insurance companies, as if we have collectively forgotten that in 2017, when Trump and a GOP-led Congress sought to undo the law, it sparked a public backlash, and a Trump-backed Republican repeal bill sought to roll back the subsidies for expanding coverage and unwind some of the ACA's protections for people with pre-existing conditions until it fell one vote short, when Senator John McCain voted no, and the entire Republican establishment spent nearly a decade trying to destroy the one piece of legislation that brought health care to millions, while now Trump has the unmitigated gall to stand there and claim it's Democrats who are in bed with insurers, and you want to scream into the void because the reality we're living through right now this very second, as House Republicans unveiled a narrow health care package that does not extend soon-to-expire Enhanced Affordable Care Act subsidies, and GOP leaders opted against extending the enhanced subsidies as part of their highly anticipated plan, though they expect to allow a floor vote on an amendment related to those subsidies set to expire at the end of the month, is that Republicans are engineering a healthcare apocalypse that will devastate working families while pretending to save them from insurance company greed. And here comes the next bombshell, because premium payments will more than double on average, and the expiring beefed-up subsidies along with rising healthcare costs contributed to insurers hiking rates by 26% on average for next year. But what enrollees will actually pay will be far higher, because they won't have the additional aid, and premium payments will more than double on average, according to KFF. So when Trump declares this is the Democrats' fault, and their fault alone, he's literally describing the catastrophe that his own party is orchestrating right now. This instant in December 2025, while Senate Republicans blocked a bill to extend the enhancements and prevent millions of people from seeing their healthcare costs spike starting January 1, and instead of supporting this common sense and urgently needed legislation, Senate Republicans put forward a partisan proposal that fails to extend the premium tax credit enhancements and would leave people with less coverage, higher costs, more medical debt, while congressional leadership and the White House have similarly blocked any meaningful effort to reach a bipartisan compromise. And you're watching in real time as millions of Americans are about to get financially obliterated, and Trump is standing there blaming Democrats for premium increases that are happening because Republicans refuse to act. And here's where your blood should be boiling, because this isn't incompetence, this is strategy, this is deliberate, and this is exactly what they want. Listen to how the con works, and this is the part that should make every progressive organizer in America mobilize immediately, because Trump says in that clip that he wants money to go directly to the people, so you can buy your own health care, and you'll get much better health care at a much lower price. And this sounds almost reasonable, until you understand that Trump specified that Republicans should give money directly to personal health savings accounts, and GOP policymakers have often championed HSAs, because in theory they reflect Republicans' preference for individuals' choices over government intervention, which sounds empowering until you grasp that what they're actually proposing is depositing up to $1,500 annually in health savings accounts for people making up to 700% of the federal poverty line, with high-deductible ACA plans, where the money could be used for expenses like copays and medicine, but not for premiums, so you're getting maybe $1,500 a year to manage catastrophic health expenses, while ACA marketplace enrollees on average would see their premium payments more than double next year, growing by a 114% from an average of $888 in 2025 to $1,900 in 2026. and the increase in premium payments with expiration of the enhanced premium tax credits is even higher than previously estimated for two reasons: Trump administration changes to tax credit calculations and rising 2026 premiums, which means that $1,500 evaporates instantly, and you're left holding the bag for thousands more in premium costs. And this is what Republicans call putting power in the hands of patients instead of insurance companies, when actually nearly all Obamacare premium tax credit dollars constitute direct spending going to large health insurers like United Healthcare, not patients, and over $100 billion of the annual spending goes directly to large health insurers, and the PTC is the largest refundable tax credit in the tax code, and over 83% of it is direct subsidy spending, not offsetting any owed taxes. So extending the enhanced credits is a $400 billion giveaway to insurance companies, not tax relief for American families, according to Republican talking points. But wait, that talking point is a sleight of hand because yes, the money flows to insurers, but it flows there to pay premiums that consumers would otherwise be crushed by, and the entire point is making insurance affordable for people who cannot pay market rates. And eliminating that system doesn't hurt insurance companies who will just charge full freight. It annihilates working families who suddenly cannot afford coverage at all. And the next bombshell drops when you realize what's actually happening to healthcare in America right now. Because a cancer patient's premium this year was $541 a month, but next year without enhanced subsidies her premium is set to soar to $1,758 a month, far outside her budget, and she says, "I have to face the reality that I am probably going to become a late-stage cancer patient who's uninsured." And this is not a hypothetical. This is a human being with a name who is fighting for her life, while Trump stands at a microphone talking about how Democrats made insurance unaffordable when the enhancements helped spur a doubling of enrollment in the ACA marketplaces and contributed to record-low uninsured rates, but are set to expire at the end of 2025, and marketplace enrollees are already starting to see the impact. And if Congress waits until the end of the year to extend the enhancements, 1.5 million more people will be uninsured in 2026, compared to an earlier extension, and the reason they're going to be uninsured is not because Obamacare failed, but because Republicans are systematically dismantling the subsidies that made it work, and Trump has the audacity, the sheer unbelievable nerve to stand there and say insurance companies got rich off Obamacare, as if the solution is to make insurance unaffordable for millions, rather than regulate insurance company profits more aggressively or move toward a public option or universal health care, which is of course what progressives have been demanding for decades. Now here comes the historical bombshell that should radicalize every single person watching this, because Trump is deploying exactly the same playbook Republicans have used since the New Deal to dismantle the social safety net, and you can trace this genealogy directly from Reagan, declaring government is the problem, through Gingrich's contract with America, through the Tea Party assault on Obamacare, and now to Trump's concepts of a plan, which during the presidential debate, Trump said he had concepts of a plan to replace the Affordable Care Act, but offered no details, and 8 years after he was elected president on a promise to repeal and replace the Affordable Care Act, former President Trump still hasn't decided how he wants to do it, and that's because there is no plan. There never was a plan. The cruelty is the plan. The chaos is the plan. Because when you sabotage a program and then point to its dysfunction as evidence that government can't work, you're engaged in a fundamentally authoritarian project of destroying collective solutions to social problems in favor of market-based individualism that inevitably means the rich get care and the poor get nothing, and Trump can claim Democrats are beholden to insurance companies, while Trump's big beautiful bill would cut roughly $1.1 trillion in healthcare spending over the next decade according to Congressional Budget Office estimates, and recent changes to the bill would cut roughly $1.1 trillion in healthcare spending, and more than $1 trillion of those cuts would come from Medicaid. Which means we're not just talking about marketplace insurance, we're talking about gutting Medicaid, the program that covers approximately 72 million Americans currently enrolled in Medicaid, about 1/5 of the total U.S. population, and Medicaid is the primary payer for the majority of nursing home residents, and pays for around 40% of all births. So Trump's healthcare vision isn't about empowering patients, it's about eviscerating the entire infrastructure of care for the most vulnerable while giving tax cuts to the wealthiest. And the truly diabolical part, the piece that should make every organizer understand we're in a fight for the soul of the social contract, is that in order to receive Medicaid, able-bodied childless adults between the ages of 18 and 64 will have to prove they're either working in school or doing community service for 80 hours a month, and the Congressional Budget Office estimated that 11.8 million Americans could lose coverage over the next decade, because recipients may struggle to navigate the new paperwork, miss deadlines, or simply not apply at all, and another work requirement change could result in more than 3 million Americans losing SNAP benefits. So Republicans are imposing work requirements that have nothing to do with employment rates and everything to do with creating bureaucratic barriers that will strip millions of people of benefits they're entitled to, because as we know from decades of research on welfare reform, work requirements don't increase employment, they increase the number of people who lose benefits due to paperwork failures. And Trump stands there saying Democrats want to give money to insurance companies when centrist Republicans signed a discharge petition giving Democrats the 218 signatures needed to force a vote on a 3-year extension of the Obamacare subsidies set to expire December 31 after bucking their leadership, and just last month GOP rebels teamed up with Democrats on a discharge petition, forcing a vote to release government files on Jeffrey Epstein by a final tally of 427-1, which shows there are Republicans who understand this is politically toxic and morally indefensible, but leadership is dragging the party into an abyss. The projection here is so extreme it borders on performance art, because Trump proclaims the Democrat Party is totally controlled by those same insurance companies, when the actual data shows improvements to premium tax credits enacted in the American Rescue Plan and extended by the Inflation Reduction Act have helped millions of people afford health coverage in the Affordable Care Act marketplaces. But the enhanced premium tax credits are set to expire after 2025, and if Congress does not act, nearly all marketplace enrollees will face significantly higher premium costs, and 3.8 million will become uninsured according to Congressional Budget Office estimates, meaning Democrats passed legislation that made healthcare affordable for millions, and Republicans are letting it expire while claiming Democrats are the ones serving corporate interests. And if you want to understand who's actually controlled by industry money, you need to recognize that beefing up association health plans is one way Republicans have sought to provide cheaper, but less comprehensive policies for healthier people, and the House bill would once again provide federal funding for the cost-sharing subsidies that lower-income Obamacare enrollees receive to reduce their deductibles and out-of-pocket costs for care, though Trump stopped paying insurers to provide the subsidies during his first term in an effort to weaken the Affordable Care Act. So Trump literally sabotaged the ACA in his first term by stopping payments, and now claims the ACA is failing because of Democrats, and this is gaslighting on a scale that would make Orwell weep. And here's the bombshell that should mobilize every single healthcare advocate and every person who understands that healthcare is a human right, because by making health insurance more affordable, the premium tax credit enhancements have helped more people afford marketplace coverage, with 23.4 million enrolled as of February 2025, up from 11.2 million in February 2021, prior to the enhancements, and the PTC enhancements have been especially critical for increasing enrollment among Black and Latino people, with people of color making up 54% of marketplace enrollees in 2024, up from 46% in 2021, and between 2021 and 2024, marketplace enrollment among Black and Latino people grew by 106% and 158% respectively, which means the people who will be most devastated by subsidy expiration are Black and brown communities and working-class families who finally got access to affordable care, and Trump and the Republicans are engineering a healthcare crisis that will fall disproportionately on communities of color, while claiming they're fighting for the people against insurance company greed. And this is how structural racism operates, through ostensibly race-neutral policies that have racially disparate impacts, and if we don't name that explicitly, we're complicit in allowing the discourse to be framed around abstractions rather than the material reality of who lives and who dies when healthcare becomes unaffordable. The rhetoric Trump deploys is insidious because it appropriates progressive critique of insurance companies, but channels it toward reactionary ends, and this is a classic fascist move, co-opting left-wing economic grievances and redirecting them away from systemic solutions and toward scapegoating and market fundamentalism. And when Trump says the only losers will be insurance companies that have gotten rich, he's lying, because the House GOP bill would not do much to broadly lower healthcare costs, especially for those who buy coverage on the Affordable Care Act exchanges, and if the enhanced subsidies lapse, enrollees will see their annual premium payments increase by 114%, or about $1,000 on average in 2026, and roughly 2 million more people are also expected to be uninsured next year if the subsidies end. So the actual losers are the millions of people who will lose coverage or be forced to pay double, and insurance companies will be fine. They'll just charge market rates and collect premiums from whoever can afford them, and the cruelty of the system will intensify. But Trump frames this as liberation, as empowerment, as giving you the freedom to buy your own healthcare, when what he's actually doing is abandoning you to a marketplace where if you're poor or sick or unlucky, you will be priced out of survival. And we need to be absolutely clear about what's at stake in this moment, because as of the end of open enrollment, 21.4 million people have selected an ACA marketplace plan for 2024, and the number of people who are uninsured has dropped from 45.2 million in 2013 to 26.4 million in 2022, a historic decline, and the number of people who are uninsured has dropped from 45.2 million in 2013 to 26.4 million in 2022, a historic decline, which represents one of the most significant expansions of healthcare access in American history, and Republicans are poised to reverse that progress while claiming they're the ones fighting for affordable care, and Trump declaring the ACA as the Unaffordable Care Act is projection so pure it should be studied in psychology textbooks, because the unaffordability is being engineered by Republican policy choices right now in real time, and blaming Democrats for premium increases caused by Republican obstruction is like an arsonist blaming the fire department for water damage, and the mainstream media plays along by treating both sides as equally credible rather than naming the material reality that one party expanded healthcare to millions and the other is systematically destroying that expansion while lying about who's responsible. This is why we cannot afford to be civil or measured in our response, because civility in the face of this kind of moral catastrophe is complicity. And when Republicans campaigned in 2024 on the promise that they would make it easier for families to make ends meet, but their actions since taking office have raised costs for basic needs such as health care, food and housing, and taken away people's health coverage and food assistance, and if Republicans and the president are serious about affordability, it is time for them to prevent premium spikes. They're revealing that every campaign promise was a lie. Every pledge to help working families was cynical manipulation, every claim to care about the little guy was performance, and Trump rant about the Unaffordable Care Act is the distilled essence of that bad faith, a rhetorical flourish designed to confuse and misdirect, while the material reality is millions losing coverage and millions more facing financial ruin. And we have to name this, we have to call it out, we have to organize against it, because this is not normal political disagreement, this is a coordinated assault on the most vulnerable dressed up in the language of populism, and if we don't fight back with every tool at our disposal, then we're complicit in the suffering that will follow. And the final bombshell, the one that should keep you awake at night, is that this is just the beginning, because the enhanced ACA subsidies passed under the Biden administration, which cut premium payments nearly in half for millions, and doubled enrollment, particularly in southern red states, are set to expire at the end of 2025, and without Congress acting to extend them, these enhanced subsidies will disappear, causing net premium payments to increase by an average of 79%, and more than doubling in some states. While simultaneously the bill's restrictions on provider taxes and another strategy called state-directed payments would cut spending by a combined $375 billion according to the CBO report, and some GOP senators and experts raised concerns that capping provider taxes would threaten a critical funding stream for rural hospitals, which means rural communities that voted for Trump will watch their hospitals close, while Trump tells them Democrats made healthcare unaffordable, and this is how hegemony operates through a combination of material deprivation and ideological mystification, where the people being harmed are convinced to blame the wrong enemy and support the policies that hurt them, and our job as progressives, as organizers, as people committed to justice, is to cut through that mystification, to name the system, to identify the actual mechanisms of harm, and to build solidarity across the manufactured divisions that keep working people fighting each other, instead of fighting the billionaire class that's looting the country while Trump provides rhetorical cover. So when you hear Trump call Obamacare the Unaffordable Care Act, understand that you're witnessing a masterclass in authoritarian gaslighting, a cynical rebranding exercise designed to memory hole Republican sabotage and blame Democrats for a crisis. Republicans are actively creating, and the fact that he can stand there with a straight face and claim Democrats are controlled by insurance companies, while his party engineers a healthcare catastrophe that will devastate millions, while protecting insurance company profits should radicalize every single person who cares about truth, justice, and the basic human right to healthcare. And if it doesn't, if we allow this to pass without massive sustained resistance, then we're complicit in the cruelty, and we deserve the dystopia we'll inherit. So the question is, what are you going to do about it? Are you going to organize? Are you going to mobilize? Are you going to fight because they're counting on your exhaustion, your cynicism, your despair? And the only way we win is if we refuse to give them that victory. If we meet their cruelty with moral clarity, their lies with truth, and their assault on the vulnerable with fierce, unyielding solidarity, because this is the fight of our lives, and there's no sitting this one out.